Everyone, nice to see you all. I'm just going to start off the webinar by introducing our speaker. So, Dr. Hassan is a California native, starting his surgical journey at UC Santa Cruz. He completed his medical school training at UC San Diego, is completing his general surgery residency at UC Davis. Starting in August, he'll be beginning his colon and rectal surgery fellowship at Baylor in Dallas. He finds joy in resident education, diversity, equity, and inclusion, and advocating for physician mental health needs. When not in the hospital, he spends time working out, reading, finishing a house upgrade, and doting on his fur babies. Thank you, and here's our speaker.
Hi. I'm assuming people can hear me. If not, I guess let Jubin or Marco know. Hi, yeah, I have a PowerPoint, but I mean, it's basically what everything was. I don't know if I could share my screen. I'm going to just share the PowerPoint, and I'll talk about my journey. And then this is really, I've done this before. I like talks like this. It's it's for you guys. So I don't want to do too much talking about myself. I want you guys to be able to ask questions and kind of, you know, pick my brain about what the journey is. Sorry, this is being weird, but maybe you can just see. Can you see my slide? You can see the slide deck. It's fine. How about that? There we go. That's somewhat better. So yeah, I was interested in medicine in elementary school. My mom was a nurse, so I did a lot of flashcards with her. You know, all the biology, and that really got me interested in science. And then it was actually in high school. She got really sick, had a surgical complication actually, and it was the general surgeons who, you know, quote unquote, fixed her, but also were the ones who were literally the most supportive physicians in her care. Like they had her back. They constantly were, you know, egging her on to like keep healing, keep working hard, like don't give up. And you know, she's alive today, has had a lot of, you know, mishaps along the way, but her general surgeons were the ones who really inspired me to want to go into surgery. I went to UC Santa Cruz, did a degree in molecular cellular and developmental biology in 2011. And then I took a couple of years off, like the traditional gap year. I took 3 years off. I did research at UC Davis, which was actually part of the UC Davis surgical internship program, like research adjunct, which was something that actually, that's how I met Jubin many, many years ago. So I got introduced to that, did some research, worked with some of the UC Davis faculty. And then I went to UC San Diego for medical school. I don't wear bow ties anymore. I think that was like a thing I was into back then. But I loved med school, every part of it. I wanted to do OB-GYN. I wanted to do psych. I wanted to do internal medicine. It was also wonderful. And, you know, and I ended up not settling, but I ended up going with general surgery because that seemed like the best fit for me. And I got to touch a little bit of all those specialties that I am so interested in. This is a little bit of an older slide, but I graduated already, clearly. This is my like terrible residency photo for applying to my surgery residency, UC Davis. As you can see, even back then, I was interested in surgical oncology, colorectal, and pediatric surgery, and I love to teach. So I'm still doing that. I did 2 years of research in pediatric surgery during my residency. Wasn't for me, which is fine. I found some really good mentors in colon and rectal surgery and matched at Baylor in Dallas. I'm currently getting ready for the move there in about a month. And I'm really excited to be part of that community and to be doing colorectal surgery and hopefully working with residents, medical students, and people interested in going to medicine. This is kind of what filled my cup. And then there's some like goofy photos. I was a scuba diver. I used to surf. I love to read. That's one of my cats. Point is, like, I'm more than just like a surgeon. Like, there's a lot of you who might want to go into medicine and surgery, but there's parts of you have to keep enriching as you live your life. Like, don't be one dimensional. Do everything you can and be a whole person, because that speaks a lot to us for those when we're looking for people we want to kind of bring into our field. I'm going to stop sharing. Let's see, how do I stop sharing? But yeah, I'm open to questions now. I want to stop sharing. It's been a minute. Anybody? Anybody?
We have one question in the chat so far. Oh, we have two
Yeah,
now.
stop sharing. There we go. All right, go for it.
The first one we have is how's the process to apply for medical school, such as San Diego? What did What does the medical school look like in most terms of activities? What is the best activity? Or I could just go one at a time. First one was, how was
Oh,
the process?
I can see
Yeah.
the Q&A, right? Okay, perfect. So, San Diego. Okay, so the process for any medical school application, you need to have like 4 years of undergrad. Like that's the minimum. When I say 4 years, that's traditional. You need to finish your degree, and it can be a degree in anything. It doesn't matter. A lot of us go into biology degrees because it satisfies all of the prerequisites. So the first thing is you got to look at what the prereqs are for medical school. Now it's like sociology, biochemistry, organic chemistry. It's called all kind of the heavy sciences. So you could do a history major, and I have a couple of friends in residency who were like not traditionally science majors, but they did all of their prerequisites and did really well in them. And so that's it. You've checked all the boxes. So that's the process to apply to medical school as a whole. You need to have your prereqs, and then you need to have some, you don't need to, but it looks good to have some volunteer activity where you're at least exposed to the hospital environment. That could be a scribe, that could be an EMT, that could be, hey, I shadowed this doctor for a year. You know, that could be anything where you at least get an idea of what it's like to be in medicine. What do they look like in terms of what do the most? Oh, what you mean? What do they look for the most in terms of activities? Um, being on the other end where I would look at medical school applications and even residency applications, we're not super concerned about what you do. It's more the longevity. Like if you're doing 15 different things the month before you apply, that's not great. We want to see things that you've done for your stint at a place. Like when I was at UC Santa Cruz, I was part of like the Muslim Medical Student Association for several years. I did a lot of outreach with the homeless community for most of my time in college. So that's what's more important is that you stuck with something and you carried it through, and if it was a project that you finished it. It's not one thing to say, oh, I have 15 papers in process. Like even if you just publish two, which is great, but you finished a project. Um, okay. And then the next part of that is what is the best activities to stand out when applying to medical school? I think I kind of answered that. You just want to show that you can dedicate yourself to something and you can finish a project. Example, I play two instruments. I play guitar and piano. That came up on a lot of my interviews. Oh, like, were you classically trained? Like, do you write? Do you compose? And it's like, I'm not classically trained, but I taught myself and I played for over 10 years. And like, that's what they want to see is that you can stick with something and push yourself and continue to be active in a hobby. What was your thoughts on the MCAT while you were applying, and what are your thoughts now? Good question, John. The MCAT was tough for me. I mean, I'm not like a super brilliant dude by any means. I just work really hard, and I took time off to take the MCAT. Okay. I think the thing that the MCAT's important is it shows that you can study for something. And that's, I think, the core brunt of it. Also, is that a lot of those concepts you study for the MCAT, you're not going to see in medicine. And in medicine, you're going to learn so much in your first 4 years that you're never going to use again. And that's part of, I think, what that test is trying to get at is if you can hunker down, if you can absorb the knowledge, be able to use it for that test, and do so well. Because a lot of medicine is learning on the fly, being able to assimilate information quickly and applying it to your patients. My thoughts on it now, I know it's changed quite a bit. The scoring is different because I also used to teach for Kaplan for the MCAT before it made that whole big change. I remember when it was like 45 was like the best score, and now it's like some 3-digit number. I think it's the same thing. The issue is you have to have some degree of a filter. Like if everyone applied to medical school, we would just be so inundated, even for people who would be great candidates. It is a thing that weeds people out. So if it's something you feel you're not strong in, get a tutor. Take the extra time to do well on that exam, because once you're done and you have a good score and you feel happy, like it's done. There's no more worrying about that test. So it's kind of one of those things, eat the frog, like do really well the first time, and then hopefully move on from it. And if I'm going too fast, someone please let someone know. Otherwise, I'm going to keep going through questions.
You're fine.
Okay, since you had so many different fields that interested you, how did you decide on pursuing general surgery? Um, so general surgery before like the current period was really that it was general surgery. You covered head to toe. A lot of specialization over the last several decades, even into the 1900s and on. So that's why you have neurosurgery, orthopedics, OB-GYN. But really, the core of general surgery was like the barbers. Those were the ones who did everything back. The red candy cane thing that you see in books and stuff. That was the original surgeon. Today, it's kind of like I like to say butts and guts. That's what general surgery is. Like abdominal diseases, some colorectal stuff, abscesses, whatnot. But what I love about general surgery is that I touch every specialty. I will work with neurosurgery when we're dealing with really sick trauma patients. I will deal with psychiatry when I have a patient who swallowed razor blades, for example. I will deal with OB-GYN when we're doing a complex colorectal surgery and the tumor is invading to the uterus, for example. So general surgery is still broad enough where I get to work with so many different specialties, and that's what I love about it. Is I'm not just kind of out here on an island. I get to work with so many wonderful other physicians, and it keeps me fresh. It keeps me engaged in what's new, what other specialties are doing, and I just like that it still makes me feel like I'm part of a team. And medicine is all teamwork. Like you cannot do medicine alone, and general surgery has given me this wonderful opportunity to be a team player, work with other people, and just continue learning. And that's really what I love about general surgery. The question might be why, and I'll kind of add on to this. Okay, then why colon and rectal surgery as a fellowship? I think colon and rectal surgery is like general surgery plus. You're adding a little bit more to your repertoire, specifically working in the pelvis and doing colon and rectal cancers. And then you do more specific training in anal rectal diseases like hemorrhoids and fistulas. But really, it's a lot of general surgery too, which I love. And so my future practice, hopefully, is colorectal, and then I'll take some general surgery call. So I'll still be involved with all of those different specialties as well. Uh, when did you decide it was time to apply for medical school, and did you submit your primary and secondary as soon as possible or later? Okay, awesome questions. Um, the time, so a lot of people, I think now the gap year is becoming less and less of a taboo thing. A gap year is good. I actually look for it in applicants unless you have a reason why you just went straight through, and that's fine too. Some people do that, and that's fantastic. I needed time off. I had been going to high school, college, and I wanted a little bit of a time, a little bit of a break, spend time with my family, work a little bit. I didn't have a job, I was in school. And so it was a good time for me to pump the brakes and really also figure out, is this really what I want to do? Because once you sign up to go to into medicine, you're relegating yourself for a minimum of at least 7 to 8 years, 4 of medical school and then 3 to 4 of fellowship, minimum of 7 to 8 years. And so after I took some time off, worked a little bit, made some money, and then took my MCAT around that time. So I would say a year or two after I graduated college was when I felt I was ready. I felt like, okay, I want to do something more with my life. I've enjoyed the time with my family. I've enjoyed these jobs I had, but I'm not being fulfilled. And that's going to be very personal for everybody. Some people want to go straight through. Some might take 3, 4, 5 years off, which is fine. However, you have to make sure your prereqs don't lapse. There is a period of time before they'll be like, hey, if these are more than, I think it's 5 years, you have to retake it. So keep that in mind. I was like right at the cusp. I think I had another year before I would have had to retake my college courses, which for me was an absolute, I wasn't going to do that. So primary and secondary, you basically want to submit them ASAP. And what I did, and I probably have the Excel sheet somewhere on my hard drive, is I would write each secondary for each program in a tab, and then I would answer it. And then as you start getting more and more primary and secondaries, you get the same questions. So you can just cut and paste, edit it, tweak it a little bit, change the word count. So you pretty much have a dictionary of answers that are not like copy and paste it in the sense of you're not putting thought into it. You already did. You've already answered that question for another program, so you don't have to reinvent the wheel. And I think by the 10th secondary that I got, it was like my secondaries would go back the same day because it was just the same questions. So keep a running log of the questions you answer. and keep a running log of how you answered those. And that'll make it a lot faster. Because unfortunately, most, if not all, the programs in med school, from at least my time and what I understand it is now, it's a rolling admission. So the sooner you get in there, the sooner you get a chance to get a thumbs up. And once you get an acceptance, and if you're happy with that school, you're done. Like I got accepted to UC San Diego, and the moment I did, I said, I'm going there. I'm done interviewing anywhere else. So that's why I would just make sure you're able to turn them over as fast as possible. Preston Barker, long time no see. I don't remember you, but I'm sorry. I am considering EM or trauma surgery. I'm interested in becoming a DO though. What are your thoughts on a DO in surgery? I have had many MDs tell me I have a low chance of matching as a DO. Do you concur? I disagree. I think the stigma with the
Bullshit.
MD.
That's yeah. DOs. There's a lot of DOs in emergency medicine.
Yeah.
There's actually some DO. Well, it used to be, not anymore. DO specific residencies for both, but there's actually neurosurgery attending at Davis as a DO. So
yeah, it's
so that's whoever told you that's bullshit.
Yeah, totally. Like I know so many DO attending surgeons and DO ED docs, and
Yeah,
you know,
you have two trauma attendings that are DOs too, right?
oh yeah, we have like several, and like at the
Yeah.
base, there's general surgeons who are DOs too. That I'm at the base this month, but yeah, to Jubin's point, that was maybe a thing 10 years ago. It's not how it is now, and that stigma is gone. I wouldn't worry about that. The point is just be good, like be a good doctor. That's all that matters. Work your butt off, be good, take opportunities that come at you, and you'll be great. Like I guarantee
The
it. So
the only issue with the DO is that you have to do both the complex and the USMLE. That's probably like the only thing, but besides that, you know.
yeah, the same medical information. Did you say that you did pediatric research alongside surgery? Would you be able to speak more about that? Yes. So my program and most academic-based programs, because you'll have academic and you'll have community and you'll have kind of a blend. Academic programs, want you to be academic. So we are required to do 1 year of dedicated research. So, excuse me. So I was interested in pediatric surgery, and so I took 2 years of dedicated research time, and I also did a master's in those 2 years. So that was 2 years of just research. I got my master's. I was in the lab making mouse models on neuroblastoma. I was going to conferences. I was doing abstracts. I was just research. Didn't have any clinical responsibilities, with the exception of sometimes we would take backup call if someone of our clinical residents were sick. But otherwise, that's all I had to do or needed to do for those 2 years. I don't know if you have any more questions on that, but I think it's a nice break in between clinical to get a little time off, just to figure yourself out. It's like, am I actually really happy? And a lot of people in my program who were like married, they had kids at that time, they traveled or got married. So it's a nice break. I don't think people should shy away from taking a year off if that's part of your program. 2 years is recommended for more competitive specialties. So peds is one of the most competitive specialties. So I was like, oh, I'll do 2 years because that's what I'll need to be competitive. And for us, it was at the end of our 3rd year of residency. Some of my colleagues in other places, they do it at the end of their 2nd. I think at the end of your 3rd is good, because by the time you're a 3rd year, you've operated a bunch, you feel confident in what you want to do, you have a good sense of what's going to be important for you. So then your research years are more fruitful. Not that they're not when you're at the end of the 2nd year. At least my experience has been 3rd year was a good time to take time off, if that's what the program will allow for.
Dr. Hassan, I had like a question or follow-up question to that. Would you have considered like an MD, PhD at any point, like in terms of research, or was surgery like the main kind of like focus for you?
Yeah, it's a great question. So the MD, PhD, right? You typically will do in med school. You'll apply MD, PhD. I probably had like trauma at some point when I thought like, yeah, that's what I want to do, but like, it's not for me. Like, I am not an MD, PhD. I know that. Like, I commend people who want to do that. I don't want to be that guy ever in my life. I just want to operate and take good care of patients, which is something like I didn't find out until later. Like even with the pediatric surgery research, I was like trying to force myself to be that person. I'm not. And if you're not, don't do it. Like, be honest with yourself. You can do that if that's what you want to do. If you want to be academic, then an MD PhD isn't like a terrible idea. However, you do take you do time off between like your first and second year of medical school, and then you do your PhD, and then you come back. So that is a break, but it's not really a break. You're doing your PhD, and it's kind of truncated because it's an MD PhD program, so it's a little bit more strenuous. There's nothing that says you can't get that after medical school, like after residency. It's doable. People do it. It's just a lot harder. We had a resident in our program who literally was like, needed one more year of research to get a PhD, but she was like, no, I just want to finish. So it's doable depending on your program, but I would really question if you want that PhD, because you don't need it to do research as a physician. It is another degree, it's another set of skills, but you don't need it unless it's really something you're passionate about.
The other thing is you have to understand too, MD PhD, there's very limited numbers, but most people that are doing MD PhDs have at least 1 to 2 years of full-time lab research. So, I mean, unless you're willing to do, bench research, but also like, a lot of MDs that do research and they don't need a PhD. So it's kind of like saying this: you need an MD to do surgery and practice medicine, and and you could do research with an MD, but you can't do surgery and practice medicine with a PhD. So you just got to decide like where you want to, and the more advanced you are, the easier it is to get a PhD than, like I know a couple people like Dr. Brown who did a PhD, I think, in residency.
Ian
There's a
Brown,
couple
yeah.
people, yeah. There's a couple of people that have done it, and it's much easier. And plus the other thing is you get paid as a PGY 3 or 4 or 5.
Yeah.
Then, you know. But also there's a lot of people that do research that are very like prominent researchers, and like Dr. Farmer, she doesn't have a PhD, and I think she has like what 300 and some odd papers.
Look up Diana L. Farmer in PubMed, and like, so to Jubin's point, yeah, if you want to do research, great, do it. You don't need a PhD. That's kind of another box that I would put into what career goals, or like you'd have to give me a good enough reason why you needed that PhD to make you more specialized. And the other thing with it, this is kind of getting a little bit off topic, however, it is very hard to do both very well. There are people out there who can do it. I can list off like one or two. Bob Cantor, sarcoma expert. He does clinical and research very well. Andrew Lowy at UC San Diego, he's also pancreatic cancer guy, does it very well. But it's hard to be a good clinician and a good scientist and a good surgeon. So like like Jubin said, pick what you want to do and focus on that. Any advice to get through all the prereqs? I find some of the chemistry classes to be difficult. I know they're hard. Like, they're hard. And I wasn't kidding when I said, like, I'm not a brilliant dude. I'll bash my head into a book until I make headway. And I asked for help. I did a lot of tutoring, or I got a lot of tutoring help in college. I would go to like office hours. I'd meet my professors. I would like become their best friends because I don't know what I'm doing. I need your help. So for those classes that are difficult, talk to the professor. You make a friend group. Like watch videos on YouTube, get other extra supplementary books. And I know it's a lot of work. Believe me, I've been there, but I can't make it easier for you. There's nothing I can say that's going to make it easier. The only thing is you're going to have to work at it a little bit more, and it hopefully will come to you. I know it's not the best answer, but it's really the truth. I can't make it any easier. You just have to work on it and get help. If you need help, get help. For high school students, would you recommend taking physics, or would IB biology be a good choice as well? I don't even know how to answer that question because it's high school. Like, that's fine if you're interested and you just want to see it, but it'll make you more comfortable with physics and like biology in college. But it's not. I'm not going to look at that when you're applying to med school. I don't know, Jubin, if you have thoughts.
The only thing that I would say is that if you've never taken physics before, and if you're taking IB biology to get college credit, take the physics, because physics is a pretty hard class, and it's one of those classes that like it's built on some knowledge, and so you don't want to take physics without understanding concepts of force. And so either you take it in high school or you take an intro to physics class in college. So, and I think IB biology, I think it was good if you're applying to like competitive colleges, but I mean, I don't know. It's kind of like saying, do you want to drive a Ferrari or do you want to drive a Lamborghini type of thing? It's like,
They'll
I don't
both
know.
get you to where you need to go.
But if you've never taken physics before, probably, physics is something that you're gonna have to deal with down the road.
Yeah, and Juven, you bring up a good point. When I took physics at UC Santa Cruz, it was a 3-quarter class, which was great for me. It was like physics A, B, and C. So I got a year of just learning. And by the end of it, like I was awful at physics in high school. By the end of it, I got it. So if you can take it as an intro, so you don't feel so pressed before college, that would give you a good basis to just really take the class and excel in it when it quote unquote really matters, which would be in college for
Yeah.
your.
I tutored physics a little bit, and I could tell you people would show up and have like no concept, and it's like, well, go learn this concepts, because I can't sit there and explain them to you in 20 minutes with the question you want me to answer because I don't, unless you want to sit there and listen to me lecture. The other part of it too is I think with physics, like you need to have strong math. And that's another thing people, and strong math is you don't need to have like differential equation. Like algebra is like the most part of it that people take physics with like really poor math skills. And so, but yeah, I mean, it's kind of like, I mean, if you're in high school and thinking about this stuff, you're way ahead of the game. So,
Yeah, good. You're doing great. Just be kind to yourself. Do you mind sharing some of your favorite experiences from residency? Yeah, I'm a month away from finishing, and I'm like, we do a grand rounds at the end of the Chiefs get to do like a talk, and like I am literally on the verge of tears every time I think about it because it's been a wild 7 years. I mean, I can remember the first day I was on call, which was my first day as an intern, to I just did a case with a buddy of mine who we haven't had a lot of rotations together. We did a brachial artery exposure. The attending like didn't scrub in for the case. The guy had a clot in an artery here. We got access. We pulled the clot out. It was amazing, right? And like those are the experiences that make me feel one, okay, it's 7 years, but I know what I'm doing. Two, I'm happy. I love this. This is fantastic work. I'm so honored to be doing it. And three is I'm also with the future. Like, Nick, Dr. Antonino, he's a 4th-year resident. Like he's the future. And I am so excited for what's to come for the people going through. Other big experiences were, my first times I was doing cases on my own where attendings wouldn't scrub in, I'd walk juniors through it. Or I don't know, just like it's hard to experience, but like when the attendings, like trust you, when you've worked so hard that they're like, okay, Abdul's got it, it's fine, I don't need to. Okay, that consult, yep, not sick or sick, not sick. Okay, like you do this, I do this. It's really hard to put into words, and that's been the struggle I've had these last couple of months is really how to appreciate what I've gone through and kind of pay it forward. But it's has its highs and lows, but in general, the best things have been operating with people that I trust and that make me feel like I'm a good surgeon, and mentoring and kind of helping the interns and junior residents see that they can do it too. What was the easiest and hardest part about med school? I think the easiest in a lot of ways was your job was to be a student. That's it. Especially the first, actually most of it, right? Like even as your clinical time, you're trying to learn how to be an intern, but your job is to just learn. And besides college, really, you don't get a chance like that in medical training really ever again. Once you're in residency, you are doing the work. Yes, you're a student, but you're also seeing patients. You're writing notes. You're staffing consults, all this stuff. And I think that was the easiest, was to just sink into the role of being a student again. And I loved it. I would spend marathon hours in the library, not because I felt like I really like, oh, this is going to make me amazing. It was because I enjoyed it. I just enjoyed learning. The hardest part about med school, I think, was actually is more personal, but kind of taking a look at my mental health. I had really ignored a lot of things about myself Like, why am I so sad all the time? And then, oh, but no, I'm happy for this week. And, putting my value as a person on my test scores, that was hard because we're all like, if we all go into medicine, right? For let's say everyone here is going into medicine, we that gratification we get from an A or from like a stellar letter of rec, that's what we kind of live our life on. We need that because we know we need it to get to the next step. But I was so wrapped up in doing amazing, even though we were pass, no pass at San Diego. We didn't have like the AOA, which is like, if you're the top 10% or 5% of your class in med school, it's an award given. We didn't have that. We just had to like pass and do really, really well. Or we had to do well enough to pass and we would move on to the next thing. But yeah, I was like, if I didn't do as well as I wanted to on an exam, I would be like, I feel like crap for like a week. But I mean, look at me, like I'm going into a very competitive fellowship at a very competitive program. And I'm happy, but like my value is not on that. I have so many more things to me. And so the hardest part really med school was just working and being kind to myself because that bled through into residency. And we can talk about that if that question comes up, but being kind to myself and just knowing that I'm more than this. I'm more than the degree. I'm more than the school. I'm more than this cog in the wheel, so to speak. What are some questions you were asked during the interview that caught you off guard and weren't traditional questions? To be frank, in high school, I did academic decathlon. So I don't know if anyone knows what that is, but it's like you get a topic. And my year was China, so you read Chinese literature, like Chinese music, and we get tested on 10 subjects. Which if it's art, it's Chinese art. If it's literature, Chinese literature, and then a bunch of other stuff. But also speech, interview, and written. And like I am not arrogant, but there are a few things that I'm good at. I am a stupidly good like impromptu person and like interviewer and like speaker when it comes to this stuff. So for me, I didn't. None of them caught me off guard. The traditional questions, I can't think of anything that wasn't like you didn't expect. Because sometimes you'll hear of like, okay, if you were going to be any kind of dessert, what kind of dessert would you be? You'll get weird questions like that. They're all just trying to see how you think. They just want to, I've never been caught off guard. Like that was a question that made me feel uncomfortable. But I think as long as you are calm and you know who you are and you just are thinking this is a conversation, because you're trying to find out about that program too. It's not just you being interviewed by them. You need to interview them too. And that's a kind of a mind shift that I would recommend you start getting into. So it's really, I'm sorry, it sounds like really arrogant and egotistical, and I don't mean it to be, but I wasn't thrown off. Like I really don't get thrown off by questions during interviews. They're easy for me.
The other thing is that you guys, if the first high level interview you're going to do in your life is for medical school, then you're not going to do as well because it's really stressful. And, it's kind of saying, I'm going to go run a marathon, and the first time I'm going to do it is at the Olympics. You're probably not going to, I'm probably not going to do well. I mean, with all the training in the world, I still won't be able to run it. But I'm just saying is that, so you want to, like, you need to have the practice. And how do you get the practice? You apply to summer programs or things that require you to interview. But you also, like, apply for jobs. Like, any kind of job that you do, just apply for it, because if you put yourself in that stressful situation, you built that practice. And there's also mock interviews and stuff like that. But I still think, like, I mean, I'm one of those people that, like, I've applied for jobs and went to interviews knowing that I won't take the job, but I just wanted to do it because I wanted to do it. But that's, it wasn't from ethical, it was just more my ego than anything else. But in a sense, like, you got to be able to, and getting caught off guard is, in a traditional interview, you shouldn't, it's not so much the answer, but it's how you respond to it. And then there's also the whole MMI thing, which you have to go through mock MMIs, because you have to do it and you have to be able to answer. And for some of us that, and I think Dr. Hassan's the same way too, for some of us that could, take an interview and take it to where you wanted to go, the MMIs are much harder because it's very structured. So you got to be able to do that set as well.
I'm scrolling through the questions and trying to see if I can lump some of them. I think I've already asked about the hardest thing in med school. Let's see. I think I mentioned, do you think it's important to volunteer, shadow, and hospital the doctor to apply to med school? Yes, I think it's important for you to see if there's something you want to do. You know, medicine is still a very noble and honorable career, but it's changing. It's not as like glamorous and sexy as TV makes it. You know, I'm very tired a lot of the time. I love what I do, but
That's not Grey's Anatomy.
it's no, I've never been in a call room except to like sleep. So it's hard. And so I think it's important for you to know if it's something you want to do and if it's something you enjoy. And it also lets the interviewers, the med schools see like, okay, like they have at least some exposure to medicine. You don't want to go in completely blind. Let's see. So what are good resources and at low or no cost for the MCAT? When do you think is a good time to start prepping for the MCAT? Honestly, I'm a little far out to answer this question about resources, but there's so much stuff online now. Like there's probably like YouTube courses on the MCAT that are free, you know? So I would really recommend maybe, you know, Student Doc. I think those are probably good sites to figure out resources that are cheap or free.
We've done 8 sessions of the MCAT the last few months, and they're all posted on YouTube, and we have like 6 gigabytes of documents on our website. And if you're on our listserv, you receive that email. So there's no such thing as no cost, because you still have to pay for the practice exams. But practice exams, you know, if you do the fee waiver, they'll be free. But we have a lot, and the person who's done it is actually somebody we know, Ken Tao. You know him.
Oh, yeah.
He's done some of the sessions. So
Wow. When do you think is a good time to start prepping? Also hard because like if you're a physics and biology whiz, you might need 3 months. Like me, I forgot how long. I prepped for almost for like a whole summer and then some. So hard for me to answer that question. It's going to be very individual. Practice tests are good to get a sense of what you're deficit in, and you can focus on those. So that's how I would approach that. How was the residency application process? It bothers me that nothing is ever certain in this path, no matter how hard you work. My friend, that's most of life. You know, if I didn't match into colorectal, I would have had to reevaluate what I wanted to do. I think residency is a little bit, it's a little bit more clear, like the process. You know, you get your medical school letters, you get letters from medical school, your dean's letter, your transcript. You get all that sent over to, you know, the residencies you apply. You do it via ERAS. It's like one hub. You fill everything out in there. You have some medical schools will send you an instant primary, you'll have a primary application. Some will send you a secondary. It's you know, that's a whole nother talk, but it's pretty, in my opinion, it's more straightforward than I think people let on. What I think you're getting at is that you could be a top student and have everything in on time, and you could still not get into a program. And I wish I could make it better. I wish I could, you know, snap my thumbs and make it so that there's enough programs for everybody who wants to / deserves to be in medicine and just kind of put the work in. That's not how it's going to be. Like that's not, and I can't fix that. And I want to be sorry, but that's how life is. But we can talk more about that if there's time. But I think it's not as shrouded in mystery as it used to be. It's a lot more clear, especially looking at how people are doing it now. What is general surgery residency like in terms of daily life? So it's busy. I'll try and go from like what it's like being an intern, and then I'm a chief resident. So it's 2 opposite ends of the spectrum. An intern, your job is to like run the floor, meaning you take care of the patient on the floor, you do the notes in the morning, or sorry, you come in the morning, you get the numbers, meaning you get the vitals, the ins and outs, like if they ate, if they pooped, if they peed, their blood work, you get the labs down, any big events overnight, you make sure you're aware of it. Then you will either round with the whole team, or you'll just meet with your chief and your mid-level, your like 3rd-year resident. Hey, here are the events, here's labs, here's my plans. You know, as an intern, you want to start giving that information and making a plan, because that's what it means to be a doctor, is not just getting information, but acting on it. You see the patients, I confirm the plans, or say, you know, we're going to change this. And then I talk to my attending, make sure they're aware. If they have changes, I will disseminate it to the group. I'm off to go operate, me and the 3rd year off to operate. Then the intern finishes the notes, you know, finishes any lab orders, calls consults. And then if there's time, they should be in the operating room, right? That's kind of what it's like for an intern. You're running around, taking care of people on the floor, seeing new consults, talking with the chief and the attending and the mid-level, and just taking care of people, operating when you can. And that's kind of your day. And then you're on call, you're on overnight. Sometimes you'll cover additional services overnight. You'll have like 4 pagers and you got to take care of everyone. Other times you'll just take care of your own people. Depends on the rotation. And then as a chief, well, I guess as a third year, you're kind of doing more of the operating. You're less kind of working about the notes and focusing on the day to day. You still need to know the big picture stuff, but your job is to operate and see consults on certain services. You're just going to be seeing consults all day, operating all day, just getting your reps in. As a chief, I see a team. I am expected to know everything the intern knows. I'm expected to know everything the attending knows. Like the buck stops with me. As a chief, you're supposed to essentially be the attending. Like you are running the show. You need to be as if you're practicing on your own. And most of the time I'll know stuff that's happening before the intern does. And that's kind of your goal is you want to be the best intern you can be, which is what a chief should be. You'll oversee all the notes, you'll oversee all the plans, you'll operate, you'll assign the schedule, you'll be the one-to-one with the attending physician. Your days aren't as long, but it's tougher because you're making sure everyone's doing everything right, so you have to make sure anything that gets past the intern you catch, and that's kind of your job. And it's busy. I'm on call still sometimes. I'm on call. I'm up late 24, 28, 30 plus hours. I'm operating constantly. I'm getting calls while I'm operating. It's really, really busy. But it's not really, I hate when people say, oh, you signed up for this. It's like, yes, you did. And I did, but I'm good at it. Like, I love it. I love taking care of people. I love operating. But it's busy, and I can't really tell you more than that other than like once you go through it, you understand how rough it can be. Like I've had to give up certain things in my life. I've had to miss weddings. I've had to miss births. I've had to miss life. And that's a sacrifice you'll make. And if you're okay with it, then this is a good field for you. If you're not, then I would really strongly consider something maybe even outside of medicine, because it will call on you to put your life on the back burner sometimes.
So I would just add this to Dr. Hassan is this whole thing about leadership, why it's so important. You don't go to medical school to be a good leader. You learn that in your pre-med, being leader in your classes, leading groups, student organizations, taking leadership roles. It's because like you got to do it, and when you're in chief resident, you're responsible for what, like 10 to 15 between residents and mid levels, and then 60 patients.
Oh yeah, it
So
depends on the service. Yeah,
so if you think you're going to get that in medical school or some residency, and if you can't work well with people, if you can't, and those are all like soft skills that nobody can teach you in a classroom. You just got to be able to work with people and take leaderships and it's not even that. It's like if you and your group of friends are going something, are you the one that's going to say, oh, I'm just going to let everything happen? Or are you the ones going to say, okay, we're going to organize XYZ, or we have this thing, or let's put together a study group? Those are all leadership skills that you don't learn in a classroom. You just got to do it. You got to learn it by doing it. And surgery is definitely a little bit more, but but it's not any different than internal medicine. Internal medicine, you may have more patients actually. You may be, as a chief resident, you have up to 100 patients,
yeah.
and probably like 25 people under you. And so this is not including the nurses and all the other people that you have to check in with. And um, so think about, like, during this whole thing, like if you're just going to classes and coming home and that's it, and you maybe do a little bit of research here and there, but like being involved in the community and all of those things are really important. Um, and then also the other thing is like, what is like, we could all sit here and poke Dr. Hassan about what it is to be a surgery resident, but until like you get to go watch it and experience it, so putting yourself in situations that you could see that, those are all really important too, because it's kind of like saying, I can't, there's an old saying like going to a donut shop doesn't make you a cop, like listening to people. And so I think it's great that uh, you hear his story, but then take that next step and, you know, find yourself into those situations now because you have a lot of time and a lot of opportunities to do. So.
Yeah, that's an awesome point. Is
But I would say
that
that I would say Dr. Hassan is he was always like the I used to call him the linchpin because he would always like be like, all right, let's get this going, and and so that's the kind of like thing that you need to have, and I don't think that's taught to you in a classroom, and you got to do it you got to learn it by doing. So
um, kind of a quick aside on that note, as I'm like coming at the end of my residency, is enthusiasm is huge. Like you got to be excited and enthusiastic and happy to be there. And let me tell you, the 15th consult of the night that is constipation or a butt abscess, I'm here for the patient. I'm excited. I'm ready to get up in there and do whatever I need to take care of the patient. You might be angry at the consult, you might be angry at the person calling you, but be kind and be enthusiastic. And I'll tell you right now, that has given me so many opportunities, and it has made me a resident people want to work with. It's made me a person people want to work with because I generally am happy to be there and happy to help. But as Jubin said, they don't treat you that, and some people won't tell you that you need to be excited. And if I can't make you excited, then you need to figure out if this is right for you. Okay, some other questions.
what do they say about life is about 90% of how you react and 10% of what happens to you. So yeah, there's disappointment. You're gonna fail at different things, and you're gonna apply for an internship you're not gonna get, or you're gonna really want to go to this medical school you're not gonna like. That's all life, and nobody. When you're born, when you're born into this world, the first thing that happens to you, the doctor slaps you on the back. So you know so that's kind of like the rude awakening of life. Nobody, like, there's nothing guaranteed in life. I mean, your heart beating is not guaranteed. It could stop at any second, and this road is hard. And Dr. Hassan is towards the end of it, well, beginning the end, because when he's done with fellowship he'll be at the beginning again. So but the thing is that it's hard, but it's joyful, and if you can't find joy in it, then you know there's other things that are joyful and you can make money.
100%. How do you find out the primary and secondary essays ahead of time?
There's a website.
Yeah, people will post them. So I can't remember if you looked at it. I honestly just waited for them to come in, but that's kind of the decision between you and your God if you want to look at them ahead of time. But you can find them online. Everything is on Reddit now. Any tips on personal statements? Don't be weird. I've heard that one a lot. Like your personal statement is it's like that can hurt you more than help you. Be honest, be passionate, but like don't come off as like a martyr. Don't try and make it like this, it's not, I don't know. The only like big piece of work I think of is like Mein Kampf, which is terrible, but like you're not trying to like stir up a people for a cause. You're just trying to say, hey, I'm passionate about medicine. Here are things that influenced me. I'm a normal person. I'm interested in these things. Like that's it. You don't have to make it, like I said, it can hurt you way more than help you. And I'm happy if there's contact stuff at the end of this. I'll send out my personal statement for fellowship. It was very honest. Oh, also don't use ChatGPT. For the love of God, like write it yourself. Like please write it yourself. Like I use ChatGPT for other stuff, like making a workout schedule, but be a human and write it yourself. Like if I can tell it's written by ChatGPT, I will instantly not want to meet you as a person. I'm sorry. Like just put your time and dedicate it. Start it early and have everyone who you trust read it. Have 100 people read it because you'll get 100 different different critiques on it, and that's useful because you're going to have hundreds of people potentially reading it as well. How did you prepare for interviews? Like I said earlier, I did a lot of it in high school. The way I did prepare for it officially was I had some mentors. I had a late friend of mine, my best friend's father, Edwin Henry, who was a physician's assistant. He did some questions with me. And then after that, I would find like mock MMI stuff online, and then I would record myself answering those questions. And then I'd watch myself and see my mannerisms when I would say or pause. And then I just got really good at getting comfortable with answering questions. And that was just, a lot of it was just doing it a lot, but also seeing what I look like when I did it. And the next level skill for interviewing that everyone should get to, and what Jubin was saying, you have to do a lot of them before you feel comfortable in a high stress situation, is you kind of, and I'm only saying this because one of my mentors said it. I think it's a little bit politically incorrect, but like you get schizophrenic with it. It's where you can see yourself interviewing and you can kind of see that, what are your manners? How are you moving? Are you confident? Are you comfortable? And that's, I think, the final level of interview prep is where you can do the interview, but the whole time you're kind of looking down on yourself and you can judge how you're giving it. And really the best way to prepare is just to do a lot of them, record yourself, see what you look like, catch the words that you use a lot, and work on trying to have easy flow of speech and slow down. People talk really fast. So learn to slow down and just be comfortable answering questions. Okay, everyone good? Thumbs up? All right. Did you have to take any situational judgment tests? No, I don't even know what those are. So Jubin, if you want to comment, I don't know what those are.
Basically, basically they're these new tests that they've come up with. One of them is called Casper, the other one is called Preview. Unfortunately, you got to take both of them because some schools look for Preview, some schools look for Casper. It's just another fee, another test. Although the good thing about it is they're more like ethical questions, situational questions they ask you. Some of them that they do like through it's more like a MMI, but you got to do it in front of a camera. Just do both of them because some schools require one and the other. Some schools require both, and they still haven't decided, which one. So, yeah, this is before your time.
So there's some other longer questions that I'll try to get to at the end, but I want to get through kind of the heavy hitters. What about MD, MPH? Are there many med schools which offer this? I don't know. At least in my residency, I get a lot of my colleagues who did 1 to 2 years of research got an MPH in residency, so that's a possibility. There are definitely careers around it. We need a lot more physicians in public policy, so having an MPH would be very helpful. But again, it's more academic, so it's hard to use an MPH in a not academic setting. That's what some people would argue, but if that's what you're passionate about, you can still make it work.
It's much harder getting into medical school. Once you're in medical school, if you want to do an MPH, you could take after your third year, do it. Not a problem. You could even go to other medical schools and other public health schools and you'll do fine. But again, getting into medical school is much harder than MPH school. So,
for post-bac students, how would you recommend students go about looking for research experiences prior to med school? I have a few friends who did the post-bac. I would talk to your post-bac colleagues in the program because usually they have connections because that's the whole idea of a post-bac, is to get you, polished up for a medical school application. Ideally, they should have resources. If not, you cold call people. You ask for your colleagues. You ask people if in other places, other programs who are in med school or who are applying. Like, hey, how did you get into? Do you know anybody who needs a research assistant? A lot of the people when I went to college, they would just show up at the office hours of these faculty and say, hey, I'm interested in your lab work. Like, they'll read the stuff and have an idea of what they're doing before they go talk to them. But that's how I would go about it. And to be honest, I was lucky that my research experiences were through the program that I mentioned earlier. So I applied, showed my interest, and I got plugged in. And then in residency, I knew the attendings and I knew that they had stuff going on, so it was easier. I'm not exactly the best person about how to find experiences de novo, but cold calling, emailing, meeting people face to face and asking if you have work that I can participate on is how I've had other people or had colleagues in the past, when they tell me their journey, how they've done it. I think these next two questions are great. So let me answer this one more, and we'll get to those two. If I'm currently working as a scribe, do you think shadowing is still necessary? I don't think it's necessary at that point because you're in the trenches, you're working closely with physicians. If you want to shadow, that's awesome. I would definitely say go for it, but don't let it take away from if you have other hobbies or other interests, other things you want to finish. I wouldn't just It's better to get, 100 hours of shadowing and then finish your, finish a marathon, for example, or, finish like some other big event or some other big hobby that you've been working on. Then like I did 400 hours of shadowing and that's all I have to show for it. So you need to have a balance.
But also, don't do shadowing right before your organic chemistry exam
Oh yeah.
to say, oh, I did all this shadowing and it's going to replace my organic chemistry grade, or the day before you're going to go take the MCAT, I mean, do it to get motivated, but like,
Yeah, it should not, it's kind of like what we tell residents, right? Do not let any research opportunities make your clinical work suffer. You have time for that later. You can shadow later. Shadow when you have time to. Okay, so these are two questions that I'll try and lump together. How do you deal with burnout during residency? Don't you have to work a lot of hours? Yes. If you were able to do everything from undergrad to residency all over again, what would you do differently? So burnout is true for any, I think, career. Some are more prone to it than others. I think medicine, it really is, it's not just burnout during residency, it's going to be burnout during your career as a physician. And there's the original definition of burnout, I forgot who wrote it, but it was something along the lines of, it is the erosion of one's soul. It's a really beautiful, beautiful quote that I'll pull up as I'm answering the question, because I think everyone should hear it. How did I deal with burnout? Maybe not the forum to talk about a lot of my personal struggles, just because that's just another TED talk, and maybe y'all don't need to hear about this. But I have depression. Like I see a therapist for it. I'm medicated. I don't care if people know. I think people should be more upfront about talking about their medical or their mental health issues. I had a lot of suicidal ideation in medical school and in residency. A lot of that's better now. Like I don't have those thoughts. And a lot of it was like, am I actually happy here? Everyone seems to be so great, but comparison is the theft of joy. Like a lot of my colleagues were struggling, they were feeling the same things, they were going through the same things, but in medicine and especially in surgery, we are taught to not complain. We're taught to just bear down, work hard. If you ask for help, you're weak. And that culture is changing. And I am happy and proud to say that I'm part of that culture of like, no, ask for help. Like I will never look down on you for asking for help. You're stronger in my eyes if you ask for help, because it shows insight. So I dealt with burnout with getting help. I asked for help. And I'm very open. I'm very upfront with my colleagues. I'm like, hey, like Lexi, like I feel like dog shit. Like I'm like, is it just me? He's like, no, like this rotation was hard. I'm miserable. I'm not seeing my husband. Okay, so it's not just me. Okay, talking to like attendings who I've actually become friends with. They're not just like these leaders, they're actually colleagues of mine. Hey, Dr. K, like, was it always like this? It's like, no, it gets better. But yes, it sucked for a while, but it gets better, And taking time for myself. Like I'm really big on working out. And if I don't work out, if I don't make time for it, I get depressed. I get really despondent. And I know I need that. I know I need to be physically active. I know I have to read for fun, not just like Sabistons, not just like clinical case scenarios. I have to read stuff. I just finished Project Hail Mary like last night, so the things I know that feed my soul, I made it a priority to fit it into my life, like my non-negotiables. Yeah, and take care of yourself. If you need time off, ask for it. Don't do something stupid. Don't hurt yourself. And I think if any of you are around, I'm giving my Grand Rounds talk June 17th at UC Davis, 6:45 in the morning, and like it will be a lot more personal than this, but like you got to take care of yourself. So ask for help. And I think if you were able to do everything over again, I think what I would do differently is I would have asked for help earlier, to be honest. I think I was struggling a lot in med school, as I mentioned. My self-worth was tied up into my grades and into how well I did on my rotations, which are important because I'm here now. But I think if I was a little kinder to myself, a little more thoughtful, a little bit more generous with love to myself, I'd be a little bit more advanced along this journey of self-discovery and self-care. But I'm here now and I'm happy. Like I'm not like fibbing. I am happy. Like I'm very excited about the future. I'm in a good place. And I think I would try and do a little bit more of life during medical school. Like I was a good student, but I didn't enjoy San Diego as much as I should have. I did my fourth year, like that's the year everyone kind of like enjoys because you've like matched and you're ready to go. But I could have done more. I could have gone to the beach more. I could have traveled more. And I'm really hoping after fellowship that I'm going to be a lot less of I could have. Even in fellowship, like I already have plans for even during fellowship to go and do things with my family and friends. So less of the I wish I could and like just do it. Like life is short. Take care of yourself. Work hard to get to where you want to, but take care of yourself. I really, really mean that. And I don't want to sound like a broken record, but take care of yourself. That's what I would have done differently. I would have taken better care of myself, 100%. And then the last thing is that the burnout, this is the quote. It was from, what was her name? Christina Maslach. She was the first one who kind of coined this term. But burnout is an erosion of the soul caused by a deterioration of one's values, dignity, spirit, and will. And that's what I'm saying is medicine is not all it's caked up to be now. Like it is a lot harder, a lot of more administrators just trying to like eke away at you, but it always comes back to the patient. So remember that and try and keep that as you're going through this, because there'll be times you'll probably want to quit during there's probably times during you're going to med school when you're doing all that where you want to quit, and I'll support you either way. I promise I will always support you if you want to leave, but I'll make sure you're doing it for the right reasons. And Preston Barker, I remember you now. I remember you. Dr. Hassan learned that leadership from AFJROTC. So I went to high school at Vanden High, which is right next to the hospital, David Grant Medical Center in Fairfield. And I did Air Force Junior ROTC all of high school. So that was something else I did. I did 4 years, and that was great. People liked seeing that I did something for an entire block. Yeah, I remember you, Preston, now. I got you. Let's see, what other questions? Have you always been confident in what you do in your desire to pursue medicine, or did you grow up with a lot of self-doubt? I feel like I compare myself too much against others, and I feel like fear and doubt control me rather than curiosity and passion. This is a really important question, so thanks for being vulnerable. The thing for me is that confidence and arrogance are like cousins. They're very close. And I can count on my hands the surgeons, PAs, NPs, residents that I disrespect, that I don't like, sorry, not disrespect, like I don't really respect or look up to. And it's because they are arrogant. Because you should be confident. And like I am confident because I have to like make myself. And after 7 years of doing this, there are cases where I'm like, yes, I got this. I'm not worried. But there are times where like, you know what? I'm not like, I'm gonna ace this, but I know that I'm safe and I can use that to bolster my confidence. So I have self-doubt every day, and I think I hopefully have kind of outlined that, you know, in med school and college, like I present as like this very whole ass person who's got their shit together, but I am a regular person, right? Like I see a therapist, like I journal, I try and figure out what's going on in my head. I have no qualms about that. So the thing with self-doubt is it comes from a place, I think, of like not loving yourself. And this is, again, I'm going to sound so woo-woo with this, but you got to kind of work on where that doubt's coming from. Okay. And I had a rough third year of residency. And I would ask my mentors when I came back as a fourth year after my 2 years of research, like, hey, like, am I behind? Like, because they're like, no, like, if you were, we would tell you. Like, where was that coming from? Where was this feeling of like, I suck coming from? It's like, that's because I wasn't loving on myself. I didn't trust myself. I didn't believe that I deserved to be here. And that's a whole nother conversation, right? Like, if you got here, you worked yourself to the bone to get here. People wanted you to be here. You deserve to be here. So I really think you need to kind of evaluate that. A little bit of fear is good. A little bit of fear means that you are going to be safe. You're not going to go blazing into a case or blazing into a patient room and just like do something unsafe. A little bit of doubt's okay too, but not to the point where it stops you from doing your job. You know, yeah, it's a really important question, and I can only tell you about my experience, but self-doubt, I think if self-doubt ever truly went away, and I've had mentors tell me this, then you should probably step out of medicine, because at that point you're too confident. You might hurt somebody because you're not checking yourself. Self-doubt is okay in little bits, but not if you're like stopping yourself from doing what needs to be done. A little bit nebulous, but I kind of want to hug whoever this person is, because I feel you 100%. This is like the life that I was living, and some of these days I still feel like I'm living it.
I would just say that if you're the kind of person that trying to look at like there is confidence, like you have to be a confident person to go to do almost anything that is competitive, challenging, and requires a lot. You have to be confident, but arrogance does kill people. And being arrogant is somebody also that nobody wants to be around. And and so I think like you have to be able to, and it's a very thin line, unfortunately. And and so I think like, but also like being self-doubt, like we all have like our own insecurities and self-doubts, like we all have it. But if you're consumed by them, then I think it's really important to, having a community, but also like talking to professionals, because like it's okay to be it's okay to have the self-doubt. Okay, like but if it's crushing you to the point where you don't want to get out of bed, like and that's something that, a 30-second TikTok or even talking to us on here is really not gonna help you. But if you're self-doubt of my like, but a little self-doubt is good because it just makes you work harder. But again, if it's crushing you to the point where you can't move out of bed or you're afraid and all those different things, then yeah, talk to someone who's a professional, because like it's just really hard to do it in this setting or not knowing you and taking a complete medical history and being a professional. Um, but then again, don't look at other people around you, because everybody has to run their own race. Like everyone has circumstances and opportunities and where you're born and zip code and all those different things that you just can't like. There's not. That's why like our fingerprints is different, because not two people are the same. Everybody's different. So yeah.
Um,
Um, any other questions that you saw?
yeah, I'm. Yeah, one more. Well, clinically, what was your most stressful situation up to this point? How did you handle it? What is the best strategy to deal with such impromptu situations? Discuss with more professionals question. And how do you stay positive? Is it grit, hard work, and passion for the work? So most stressful situation, I mean, blanket statement, trauma activations where someone comes in with numerous gunshot wounds, they've got a pulse, and then they die in front of us. You got to cut open their chest, see if their heart has a hole in it, put chest tubes in. Like that's stressful. But I've done so many of them now where they're like, and again, not arrogance. I'm not trying to be that, but like a few things really stress me out now because I've seen so much that I'm like, okay, like this is my algorithm. And I think the best strategy to deal with that is before you take the patient's pulse, take your own pulse, take a breath, take a moment to just like, what's going on? I'm here. I've had like the trauma surgeon gods tell me that. Like before you take the patient's pulse, take your own pulse, meaning take a moment, one breath. That one breath isn't gonna, like, that patient's dying, that one breath isn't gonna make or break anything. You need to make sure you are in control of yourself before you jump in. Yeah, and I've discussed with like, yeah, every time at the end of any trauma, I'll talk with the attending. I'm like, yo, let's debrief. What did I do well? What didn't I do well? What would you have done differently? And we'll talk through the case. And I think as you become more and more senior, that relationship becomes so much more valuable. But I would strongly urge as a beginning level, like the early thinker, like even as a med student, like try and hear those conversations. As an intern, try and listen, try and answer in your head, what would I do? What would I have done differently? So it's a lot of the reason why this process, this program takes so many years is because you have to learn by doing, and you have to see these hundreds and hundreds of cases.
So, and I
I think
think
so.
the question was, what's the best strategy? Go to medical school, get into residency. After 7 years, that's a strategy that you could deal with stressful situations of GSW to the chest, or
Yeah,
I
yeah,
mean, it's
fair.
just, I mean, I mean, it's like it's he's explaining to you something that he's experienced through years. I mean, show your gray hairs, through years and years and years of experience and doing it. And for him to explain this to you, and everybody has different antidote and different stress. What is it? What are those things that they call stress?
Sponsors or
Yeah. So, like for example, like I worked in the ER for a few years, and like certain things don't scare me, but pregnant women still scared the crap out of me. And if they like
pregnant trauma?
if you see a pregnant woman coming around, I'm running the other way because like I don't like these pregnant women just scare me. But a gunshot to the chest or stabbing, it's like seen a few hundred of them, and so I think like that's just like and so like and that's why like they say like in medical school you should like experience those things. Yes, you're not going to be a doctor and you're not going to do it, but like being in that thing and see other people react and that hey, they do it is really important. One of the best ways to get into a hospital, and it pays like $25 an hour, become a patient transport or patient escort, is you literally have to have a CPR and they hire you and you move patients from one way to the other. And if anything exciting happens, you go watch it and you get paid for it. So it's like, but you just got to get up and do it. And but other part of it too is that these strategies, like you're not going to have any of the stuff the first day of medical school. Matter of fact, after you're done with medical school, you're going to be scared more than confident. So, and after 7 years of residency, yeah, you'll you know
Yeah, the ignorance is bliss. Like the more and more I learn about stuff, the more terrified I become because you're like, this can all go wrong,
that's why trauma attendings they bubble wrap their children.
Yeah, yeah, no jump, no trampolines. Like we're not going to like any theme parks. The last question, I think, how do you stay positive? I don't know, and like I feel like I've always been. I we're it's gratitude. We're really lucky to be doing what we're doing, and don't get me wrong. If you haven't, and none of you have, and I don't know if any of you will. After like a 30+ hour call, I have seen 20 consults. I'm covered in blood and pus and some other bodily fluids. I haven't eaten. I haven't slept. I smell like garbage. It takes so much for me, the mindfulness of like, Abdul, this night sucked. You got destroyed, but like, think like you got to operate, you got to help people. Believe me, after 32 hours, like I hate everything. And that's okay. If you haven't slept in that long, you should not like anything. But it comes back to gratitude. Like I'm really grateful to be doing this. I get to teach people. I get to help people. I get to intervene in people's lives in a really meaningful way. And that is huge for me. That is huge for me. And I knock on wood. I hope in 10 years I'm the same. Hope in 20 years. I hope the day before I retire from surgery, still this excited about it. And I think I will be. And I think I will be. And if that's something that you're worried about, like really reevaluate what it means for you to want to go into medicine. It shouldn't be because your parents want it. It shouldn't be because you think it'll look cool to have an MD or a DO or like wear a white coat. There's other specialties, other things you can do besides medicine that'll give you that sense of honor and pride. Medicine is a different beastie. Okay. We have like 13 minutes. There's some other questions here that are, I think, more specific. I could try and answer them briefly. They're a little bit out of my scope. Halfway through nursing school, and while I really enjoy it, I've noticed that I'm especially passionate about the medical side of things, like learning about physiology and disease processes in more depth. Lately, I've been thinking about the possibility of going to medical school. Do you think this could be a good path for someone with my background interests? I mean, sure. Like that's a really personal question. I think nursing is hard and it's great on its own, but you could like there's different levels of nursing. You can become like a surgical ICU nurse, which is like you are buddy buddy with the physicians. You're doing lines, you're taking care of art line, not doing lines, you're taking care of arterial lines, you're like administering meds, you're being very, very involved in patient care, and you got to know your physiology. Or you can become a nurse practitioner or a physician assistant. You don't have to go to medical school to do the things it sounds like you're interested in, but that's a whole nother conversation. But if you're interested and excited, I would feed that passion. I wouldn't just ignore it. This is a good question. How has dealing with life and death affected you or psychologically, and how do you overcome it?
If it has not affected you, then you need to talk to someone, because it's still, it doesn't get away. I mean, I still remember like the first person that died on me.
I remember and it was actually during the surgical literature program. It was the first case I saw as a college student shadowing. Someone died in the operating room that day. The first case I ever saw died in the operating room. Pulmonary vein injury. Just bled out. I think so. What I got really good at is compartmentalizing. So, like I said, a gunshot wound comes in, the guy or gal's already dead. I got to punch to the chest. I got to do my thing. I can, for that moment, it is just a body. My job is to try and bring this body back to life. When I'm operating on anybody, they're just a body. At the end, when the patient's sewed up and closed or whatever, if they died, they're in the morgue. Like after that, then I sit down and I kind of just think about it. I think about, one, life is precious, and I hurt. I hurt when young people come in from us. I hurt. Someone's dead. Be it a social situation, be it a bad decision, someone has died. Or even like someone in their 60s, 70s from a cancer, they're going to die. It hurts. It sucks. You're going to see the worst of humanity in medicine. Worst that life has to offer. And if you're not, as Juman said, a little bit messed up from it, so you have a little bit of psychopathy, because, I mean, it sucks. I don't want to see people hurt, but you will. The patient you saw 1 week, hey, you've got metastatic cancer. They're going to die, and it's going to be a shitty death. And so it means, tell people you love them. Spend time on yourself. Look at things, be happy. Try and be happy. I'm not trying to say that I'm not ever sad. I'm sad a lot of the time, but if you're healthy, if you can walk, if you can move, if you can do things, take solace in that and enjoy it while you can. And so it's made me more grateful. I work out for mental health, and I hate, I crap on myself for my numbers. My numbers, I want to be a big lifter, but I'm still grateful that I can do that, because there's so many people who can't even walk, So I just overcame by thinking and being grateful, and putting more love out in the world as much as I can. What is the best way to practice best self-care and to renew to yourself? It's different for everyone. What do you do? Yeah, I exercise, I journal, I go to therapy. Sleep is big. I've been really big on trying to get at least 7.5 hours of sleep. It's doable, but that means you're the loser who goes to bed at 8:30, which is fine. I don't care. Look at all the literature. There's a book by Matt Walker, Why We Sleep. We're all killing ourselves if we think we can burn the candle at both ends. Residency will cut your life short. Try and find the time to sleep. You will feel oodles better, and you will be better for it.
But for each person is different though. Self-care, somebody, I have a couple people I know that love going to getting massages or things like that. Me, if somebody touches me, I just want to scream. It's like torture. So it just depends. Everybody's got a different thing. It's I like getting pedicures. I think they're really fun and it makes me feel really good, and it's a really good self-care. Everybody's doing it differently. Some people scuba dive, some people go sailing. It's just kind of we're all different, and we all have different ways that some people watch, what are those things, reality shows, I don't know, to me it's just I rather burn my eyes out than watch reality TV, but some people really like that. What is that one called? It's married women that housewives something.
Oh, like Housewives of the County or something.
Yeah, like there's all these housewife stuff. Some people like that, to them that's self-care and renew and recharge. To me, like I would burn my eyes out than to spend a minute on that. But that's just like um
You gotta find what eases your soul. You know, and it could be anything. Um, okay. Would you recommend someone who's had low GPA complete a post-bac program or master's program with linkage to med school? Yes. At UC San Diego, we had a post-bac program there a lot. And like, I actually, was a guy, Alex, forgot his last name. He did the post-bac, and I actually just saw him like 6 months ago at UC Davis. He's now a home crit care fellow. So that there are pathways to do that. So if that's something that you're interested in, you've got to look for them, but they exist.
yeah, look
Um,
at post bags, look at DIY post bags. Some of those post bags are really expensive and you can't get financial aid. So, but if you get a master's program, it won't impact you, like it won't change your undergrad GPA. So make sure, um, like, look at which options are best for you. Um, yeah, and so it's just that's the problem. Like post-bac GPA like impacts your undergrad, but your master's GPA doesn't. So that same goes with MPH and other stuff. So just look at what you need, what's missing in your application. The other part of it too, if you haven't like taken the MCAT, like focus on that because I know a few people that have gone in with low GPAs, but really like kick, butt. But I would just say like if your science GPA is below 3.0, like it's just going to be really, really challenging. And so try to raise that and try to do better. Um, but it's possible. Um, this person wants to know about they're a pharmacist. So it depends. Like, if you're coming from a country that your pharmacy degree is not recognized by the US, then it's really, really hard. Some places don't recognize like your degree, like the US, if it doesn't recognize your degree, then you're basically like starting from scratch. Some countries, they don't recognize their bachelor's degree, so you're gonna have to start from scratch. So I don't know where this person's from. Like if you're from, Canada, then yeah, you could actually technically work as a pharmacist, but so I don't know where this person's from, and I would just say like I don't know, like if I don't know where this person is located either, because if I knew there are resources, there in California, there's a couple of centers that train for people, the retrain people that have medical degrees from outside the U.S., but I don't know where this person's from, so and I don't know their name, so I can't look it up. So, um, this is a best way to deal with mean, rude, entitled people.
um, Kill them with kindness. And I know every time I have been a little bit snippy, I have come back to apologize, even if the person totally deserved it. It's just, that's not in my nature to, and I think surgeons are cold, mean people. No, we're not. Just be kind. And remember, it's a them. It's very unlikely it's you. Sometimes it is you, but generally not you, and it's them. So don't take it personal. It's hard. That takes a lot of time, and you got to build up a thick skin if you want to do surgery, especially.
Short-term memory, baby.
Oh, I like that. I like that. Yeah, I hold on to things, but I've gotten better. Just like, okay, that was not.
Short-term memory, like just let it roll. Because the thing is, a lot of people are maybe mean or rude is because they're under stress and they don't know how to manage their stress. And so it's easier to take it out on you than actually self-grow. But like I'm not responsible for other people's self-growth. Like that's a them problem, not a me problem. And then yeah, and I would say this in medicine and any job that you have are going to read with rude and entitled people, and you just have to figure out how to cope with them. And again, it's one of those things you got to do it by practice. Like you can't like I can't tell you how to do it because how I deal with it is very differently than Dr. Hassan would or Marco or Kirsten or you know, but also like your experiences, age, and all those different things come into play. So, um, but yeah, you know, how many school did you apply to And how did you? I think you've answered that already, but
Well, yeah, so I answered the secondary thing is as they would come in, I would write the secondary question, then I would write an answer and have like a running catalog. So by the time I got like the 10th secondary, you get the same questions asked. So you can just cut and paste that answer because it's the same thing. So just don't reinvent the wheel. I applied to, I think it was 35 or 45. It was somewhere around. I think it was like 40, which was a lot back then. And I think now people apply to like way more than that, just because it's that competitive. So be broad, even if you're a really competitive applicant, but also be mindful that don't apply to like places where you're like this whole safety school notion. Like I don't know, you're potentially taking seats from people who would like want to go there. So that's a little bit more of a morality kind of discussion. But apply broadly. Like no one's ever like really safe or guaranteed, right? That's like I said in the beginning, that's life.
alrighty. Yeah, I think we're done. We're done, and I actually have to go to work. But yeah, thanks everyone for coming. Hey, I'm gonna call you after this. I need to talk to you for a minute. I'm gonna FaceTime you. All right. You guys have a great weekend, great evening. Stay out of trouble. Don't get in any trouble. Thank you again, Dr. Hassan, for coming.
My pleasure.
And yeah, and everyone have a great weekend.